Good afternoon, ladies and gentlemen. It is 1 o'clock. It is Thursday, September 23rd, 2021. This is the regular meeting of the Board of Directors for the Washoe County District Board of Health. And with that, I will call a determination of quorum and a roll call by our clerk. Madam Clerk.
Chair Delgado.
Chair Delgado.
Here, sorry, it's a little delayed on my side.
Vice Chair Lucy.
Here.
Mike Brown is absent, Chair.
Yep.
Councilman Dare.
Here.
Dr. Odenko. Here. Dr. Novak. Here. Tom Young is absent, Chair. We have a quorum.
Thank you, Madam Clerk. I do appreciate it. And before we take a Pledge of Allegiance, I want to do a moment of silence. One of our board members, Member Brown, had an unexpected loss in his family, and just a moment of silence for his mom. So thank you. Thank you very much, everybody.
Chair, I just wanted to put it on the record that Tom Young has appeared at 1:01
Okay.
p.m.
Welcome, Mr. Young. Appreciate it. Thank you. All right. With that, Dr. Novak, will you please lead us in the pledge?
You all rise, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Dr. Novak.
Yes.
All right. Madam Clerk, can you take us into public comment, please?
Yes, Chair. We have an email from Janet Butcher that we'll put on the record with Joy Troshensky, and followed by Julie Joliker.
Yes, ma'am. And before we start into public comment, Mr. Shensker, I want to remind everybody that this is a public meeting. This is a business meeting of the District Board of Health. We would ask, as to the governor's mandates, that you please wear your masks within the chambers. If you wish to remove your mask during speaking, you may, but we ask that you put it back on at the completion of your comments. We ask for decorum today. This is a business meeting, and we will maintain that and give everybody the right that they have to speak and preside in front of us. With that, ma'am, the floor is yours. I think so.
Can you hear me?
Yeah, we got you now.
Okay. My name is Joy Trushinsky. Good afternoon, distinguished members. There is no scientific basis to continue to demand children in grade school, high school, or college students and adults to wear masks and be vaccinated with the COVID-19 vaccines. On September 2020, the CDC reported the survival rates for COVID-19. They are as follows. Ages 0 to 19, the survival rate is 99.997%. Ages 20 to 49 is 99.98%. Ages 50 to 69 is 99.5%, and ages 70 plus is 94.6%. These survival rates have not changed. For a virus that is supposed to be so deadly, these survival rates sure are high. We have cures for this virus, like hydroxychloroquine with zinc and ivermectin and others. Did you know Governor Sisolak banned hydroxychloroquine from the public, but authorized its use for the Nevada prison population in March of 2020? Because these cures were not used, many elderly died. People died in hospitals due to ineffective treatment, like the use of remdesivir. The COVID-19 vaccines being pushed by the government are untested, experimental, and do not work. Also, pharmaceutical companies are not liable for any harmful side effects. The truth is, people are dying after getting the vaccine or have experienced heart damage, blood clots, and neurological damage, including being paralyzed. The long-term effects of these vaccines are unknown, and giving the vaccines to healthy children and adults who are basically immune is wrong and dangerous. Did you know that the Joe Biden administration put out new vaccine mandates for federal employees that don't apply to members of Congress, congressional staff, White House staff, the federal court system, United Postal Service, and others? If they don't have to get the jab, why do we? I also want to say that the wearing of masks, according to the CDC, causes harmful effects, reduces your immune system, causes serious respiratory infection and death. I oppose vaccine and mask mandates and lockdowns and pray you do too. Thank you for your time.
Thank you, dear. Thank you, Mr. Chinsky. Next.
We have Ms. Julie Joliker, followed by Mr. James Benton.
Julie? Julie? All right. Seeing no Julie, we will move on to Mr. Benton. James Benton. Mr. Benton. Welcome.
Good afternoon, board members. My name is James M. Benton. I'm here today to talk about COVID-19 and medical propaganda. These 6 things the Lord hates. Yes, 7 are an abomination unto him. A proud look, a lying tongue, hands that shed innocent blood, a heart that devises wicked imaginations, feet that are swift in running to evil, a false witness who speaks lies, and one who sows discords. Today, I will be talking from an article by Dr. Joseph Mercola. America Medical Association instructs doctors to deceive. Everyone should have a copy of this article. When do noble lies such as become blatant lies? Anthony Fauci claims that he lies. The lies he's told were to protect the public and influence behavior. At what point do lies from the medical advisor in America become a reason to stop listening? The Winter 2021 AMA COVID Guide on Vaccines, Trials, and Combating Vaccine Misinformation, issued by the AMA, brings serious questions about the AMA's adherence to transparency, honesty, ethics. The guide lists 9 key messages. The AMA instructs doctors to disinform the public using psychological and linguistic tools. Word swaps include changing hospitalization rates to deaths. Page 4. Another highly questionable word swap is not to address the nitty-gritty details of vaccine trials, such as the number of participants, instead of simply refer to these trials as having gone through a transparent, rigorous process. The power of language. For example, lockdown sounds like involuntary imprisonment imposed by a totalitarian regime, which is what it is, whereas stay-at-home order sounds far less draconian. After all, home is typically associated with comfort and safety. The same goes for using COVID protocols in lieu of COVID mandates, directives. I'll end with, the Lord detests lying lips, but he delights in people who are trustworthy. Thank you.
Thank you, Mr. Benton.
Up next, we have Mr. Roger Edwards, followed by Ms. Cindy Martinez.
Mr. Edwards.
Good afternoon, Roger Edwards for the record, 48-year resident, I'm medically exempt from the governor's edict. And the governor is outside of his legal authority by extending this emergency operation anyway, and you guys know that. You don't